Thank goodness for the private sector. Without companies like Pfizer-BioNTech and Moderna, the public sector would have kept us in lockdown forever. That's one of the many lessons to be learned from COVID-19. Today on SolutionFormers, let's learn 10 lessons COVID-19 taught us the hard way, and end with some recommendations to help prevent this from ever happening again. Lesson number one, the World Health Organization and governments had an effective, proactive strategy to deal with outbreaks. Wrong. Turns out they couldn't even figure out how to declare a pandemic. Sure, they locked you down, but never did close down the borders to prevent the virus when it would have bought us time. They praised communist China in locking down their own cities while still exporting planes all over the world. They noted most people infected will recover as they would from the flu, and then condemned those who acknowledged different risk profiles later on. Time to task some of our intelligence networks to tracking outbreaks and having plans in place. Had this virus had an over 2% death rate, they would have killed millions. Lesson 2. The public healthcare system can segregate populations based on risk profiles. Wrong. Outbreak, triage. Quickly identify the risk and take action accordingly. If you're high risk, they'll let you know and take action. Wrong. That's too much work. Focusing on those at high risk, such as the elderly and those with pre-existing conditions, is too hard, too complex. Can't be done according to some chief medical officers. Let's do a tracking app instead of a proactive database. Instead, it's way more fun to hire app programmers and fight about apps than fill out databases and send out letters. Lesson 3. The public healthcare system will attempt to use pre-existing drug treatments and knowledge to reduce hospitalizations. Wrong. There was little to no effort, and even already approved drugs regularly used for other use were condemned. The health response was watching you get the virus, seeing if you lived, and maybe hooking you up to a ventilator. Here's a peer-reviewed paper. Ignored. The CBC says it doesn't help you in the hospital. Maybe if they read the article, they'd realize it reduces hospitalizations as opposed to helping you in the hospital. You know, flattening the curve. Why we locked down in the first place. But reading. Maybe the public sector will follow up and say 3 to 5 times the length of time it took the private sector to develop full vaccines. Also, sure glad Oak Ridge National Research Lab ran their Summit supercomputer model so that absolutely no action could be taken on the results. Lesson 4. The government would never leave you in lockdown forever. Wrong. No vaccine. You'd be in lockdown till you die. How many elderly died in lockdown? They even ignored their own medical professionals, noting that the lockdowns were completely ineffective. Lesson 5. The government will treat everyone equally, and the government will take care of the little guy. Wrong and wrong. The politicians and senior bureaucrats are off to Hawaii while telling you can't travel. How dare you? If you go skating outside while they're on a plane, expect to be arrested or tasered. No hockey for you, little kids, but the NHL, that's okay. Your mom and pop shop closed, but Walmart, that's okay, it's essential. You're not rich, but hey, Amazon did quite well. Thanks for the qualitative easing money. Which leads us to 6. The government will print me money that my quality of life will improve, not the rich. Well, they did print money, but your quality of life didn't improve, did it? Yeah, you went from maybe not working, living in your parents' basement, unable to afford traveling, to living in your parents' basement while airlines go bankrupt that you never get to travel. Winning. What about you union employees? Well, you got your raise, you got to keep your paycheck, and that guy got laid off. Will you keep your job? Congrats. Maybe you can spend that cash to travel. Oh, wait, you can't afford it because you took out democratized travel. Whatever. Again, Amazon doing well. Thanks for the printed money. You got what, $600 a month? They got millions. They're winning. Lesson 7. The government will act rationally based on their own models. Wrong. Look at the cheating, where AHS ignores its own modeling, showing that the lockdowns won't be effective and that there would be a second and third waves until herd immunity is reached. Oh, and the vaccine will save us, except when they previously said mutations prevented long-term immunity. But whatever, logic, psh. Lesson 8. The government will do a cost-benefit analysis before taking drastic action. Wrong, too much work. Just think, for 10% of the trillions lost, we could have built those at risk a whole new parallel healthcare system over the past year that would stay in operation for 25 years. Oh well, much more fun to light money on fire. Lesson 9. If China or some country allows a virus to kill people, we will demand answers. Wrong. Hey, viruses that shut down the global economy happen all the time, everywhere, anywhere, right? It's not like bird flu and SARS and COVID all came from communist China, that there's something going on there. Happens in India, they have 1 billion people. Wait, it doesn't. What's going on with China? What's with all these outbreaks? What is communist China doing? We can't keep letting this slide. Well, oh, sorry, I guess we will. Lesson 10. The private sector, the most important lesson, the private sector saved the day. Once again. At least we hope so, given virus mutations. Fingers crossed. But at least the private sector came up with vaccines in something other than lockdowns. So, takeaways. Number 1, the government needs a proactive plan to identify and take action on outbreaks. Real action. This can't happen again. Intelligence agencies need to be watching for this. 2, for the billions we spend on healthcare, they should be able to segregate and take action based on differing risk profiles. For the billions we spend on healthcare, that can't be too complex. Number 3, the public system should be able to innovate to save people. Right now, it must not be able to because it didn't. Health cooperatives, anyone? Number 4, don't trust the government when it comes to your individual liberties. Be active in politics. Number 5, don't trust the government to treat you equally. They're all in on the pyramid scam, as discussed on a previous episode. Know what that is. Number 6, printing money just allows the government to hyperinflate. Only the very few at the top get to buy some real estate with that. It won't increase your quality of life. Qualitative easing, it's going to help the rich. Number 7, not the middle class. Number 7, hold governments to account. Where's their cost-benefit analysis? What are you doing? Number 8, why communist China? Why all these virus outbreaks? What's going on there? We must learn why that this doesn't happen again and again. Number 9, free markets are the best way to deal with scarcity and meet demand. The private sector saved the day on COVID. Praise and honors for a free enterprise? Well, that's it for this episode. So send your questions to coolmadcoffeedad@gmail.com. I got a couple. Hoping to do an episode where I start taking questions. Would be great if I could do it at the end of every episode for some questions. So thanks for watching. Take care.